So now, Dr. Witt, I do want to talk on, you mentioned whole body health. How important is your mouth in terms of like your entire body?
Well, you know, everything is connected, right? Your mouth is connected to the rest of your body, right? And when you have infection in your mouth, it has a direct link to the bloodstream. And it's getting that infection and that bacteria and those toxic chemicals that are put out by that bacteria flowing through your whole body. It gets in your brain, it gets in your heart, it gets in your lungs, it clogs your arteries. It leads down the road, right, to major health concerns. So I tell people that, you know, if you come to me and you're not well, right, you have high blood pressure, you smoke, right, you're not skinny, right, you are overweight like most of us in the world, right, you're overweight, you have those three things going on, maybe even though, and you also have diabetes, which is a huge addition to that in the dangers of your health, right, and I look in your mouth and you have gum disease. It's not a matter of if you're going to have a heart attack or stroke. It's a matter of when will you have that heart attack or stroke, and will you make it? If you put those health conditions on top of having infection in your mouth, you are going to have a major event.
Wow.
A major event, and you might or might not survive it.
Right.
You know, and my job is to help you get that mouth healthy, because that's my part, it's my role in the whole body health. The healthy mouth is going to take the pressure off those other systems so that you can get those other systems handled. Now you have to handle those things on your own. You have to stop smoking, you have to change your diet, you have to, you know, lose weight, right? And you have to control your diabetes. But if you're doing that without having infection in your mouth, you're going to be 10 times better. There was a study done, it was very interesting. There's a certain marker in your bloodstream that shows the risk of heart attack, right? And when there is infection in the mouth, that marker is off the chart. And they can take, it was in Atlanta, a company in Atlanta, when they can send them to their dentist and have that tooth handled or the gums handled and there's no more infection, that marker drops to a very low rate and your risk of heart attack and stroke diminishes greatly.
Wow. Like that quick.
Like just like that. Just like handling that, and that marker for heart attack goes down and your risk of it is much less.
Wow.
Right? We also know that having that chronic infection in your mouth is what clogs your arteries. So lots and lots and lots and lots and lots for so many years we were like, cholesterol is what clogs your arteries. No, it's the chronic infections in your mouth that create the clogs in your arteries. So you end the chronic infection in your mouth, you handle the health of your mouth, and you're less likely to have those things in such bad conditions.
Is it true that there's like a study or some crazy statistic that's like 7 out of 10 people have gum disease?
Yes.
And that's like linked to, you know, heart disease and all these types of things that you're talking about now. I think that's kind of like eye-opening.
That's right. That's right. 7 out of 10 people have some level of gum disease.
Yeah.
Right? It can be an early level or it can be a very late level, but handling it's really important. You know, and just brushing your teeth properly, brushing your gums is really important. You know, most people, and it's crazy the amount of people, most people come to me and they're under the impression that you brush your teeth, right?
Right.
And they don't brush their gums because their gums bleed when they brush them. And people are under the impression, because they think the gums are like your skin or something, that when you brush your gums, if they bleed, you should avoid them so that they have time to heal. It's backwards thinking, because if you had a cut on your hand, right, and it's scabbed, and you brushed it hard, and the scab came off and it bled, you'd say, oh, let me let that scab heal. But let's say you have a gash that needs stitches, it's bleeding, you go to the hospital, the first thing they're going to do is scrub the wound clean. That way the wound can heal, right?
Right.
The reason your gums bleed is because the wound is filthy. The gums are disgustingly dirty and are full of bacteria that's causing an infection. And the sign of that infection is blood. So if you see blood or have pain when you brush your gums, it means brush them harder. You've got to do what the hospital would do and scrub that wound clean.
Wow.
You got to scrub them, they're going to bleed, it's going to hurt, you might even cry. Brush them harder. Because we know that a soft toothbrush, the bristles of a soft toothbrush will never ever hurt your gums or your teeth. They can't damage them in any way. But bleeding gums is the sign that you've got gum disease. It's not the sign that you have to avoid them. But most people think that when they see bleeding or if their gums hurt, not to touch them. It's backwards thinking, and the most important thing is that you get in there and you scrub it hard. And you scrub it every day, twice a day. And at the end of a couple of weeks, the gums won't hurt anymore and they won't bleed anymore, right? But you should need to get to a dentist right away and make sure that you don't have a worse gum infection that needs to be treated at the dentist.
Right. So obviously signs of gum disease are if your gums are bleeding. Are there any other signs or symptoms to let me know, like, oh, hey, this isn't totally right and I need to call you and go see you?
Yep. If your gums bleed or hurt when you brush them or floss them, that's the sign, right? If you had bad breath, that could be the sign too. Bad breath comes from lots of different places, but can be coming from your gums or your tooth infections, right? But bleeding and pain when you brush or floss your teeth is the sign that you need to see the dentist right away.
All right, well, I'll call you.
Oh, that's awesome.
Hopefully I don't have to, but
hopefully you don't have to.
Call you.
Well, you got a beautiful smile. I don't think you're going to have to.
Thank you.